Good evening. A warm welcome to all for the first session of Women's Health Inside Out, an insight into different aspects of women's health, where we focus on do it yourself as approach. आज हम जानने की कोशिश करेंगे कि हम क्या कर सकते हैं हमारे हेल्थ के लिए, क्योंकि आपको नहीं लगता कि हमारा स्वास्थ्य हमारी जिम्मेदारी है. We are women who are multitasking, who are driving force behind so many people. So our health is our responsibility. I am Dr. Varsha Sathe, founder of Aarogya Mitra Foundation. We are a team of healthcare professionals who are trying to build a healthcare system which is preventive and accessible. At the beginning, I would like to thank Allaboutbelgaum for this opportunity. What more we can do to celebrate Women's Day? As the theme for this year goes, invest in women and accelerate progress. The best investment we believe is investing in health. So today, let's get to know about the insight into the women's health. To take it ahead, I would like to introduce to you our esteemed panelists. First, Dr. Asawari Sant. She is a consultant pathologist at AAB Diagnostic and Dakshita Hospital, and AAB Diagnostic has completed 25 years of service this Jan. Welcome, Dr. Asawari.
Thank you.
Second is counselor Ashwini Belgaumkar. She is a counseling psychologist at Crossroad Counseling Center. She specializes in family therapy and adolescence issues. Welcome, Ashwini.
Thank you.
And last but not the least is Dr. Swapna Manjrekar Desai. She is a dermatologist and cosmetologist at the Reviva Skin, Hair and Cosmetic Clinic. Hi, Swapna. Welcome to the session.
Hi.
So let's take it ahead. Women's health is diverse and dynamic. In today's session, we would like to try to get the insights into the issues or the factors affecting women's health, in which we are most active, in the most active period of our life, that is women above the age of 35. So to begin with, I'll start with Dr. Asawari. We all know when it comes to health, knowledge is power. जो हमें पता नहीं उस पर काम करना थोड़ा मुश्किल होता है. So Dr. Asawari, can you tell us, elaborate about us, how I can know about the health status, my health status? What is exactly my health status?
Yes. Thank you so much, Dr. Varsha and Aarogya Mitra Foundation also for thinking of this topic for Women's Day. I once again extend my heartfelt gratitude to Allaboutbelgaum and Mr. Uday Kinzavlikar because he has always supported women's health and women's issues right from the start. So for that, I think we need to give him a big round of applause for this, going out of his way to make sure that women get a platform to talk about this. Now, the question asked to me by Dr. Varsha is how can we know our health status or our health parameters? Here we are talking about preventive health, definitely. We are not talking about tests or, consultations that we would do when we are symptomatic. So we are just covering preventive health today, and especially for women in the age group of 35 and above. Now, there is a lot of things going on in the medical field nowadays where you will see that, 100 tests, do this comprehensive health checkup in 95 tests in so and so. So these are all called as what we so-called health packages or healthcare packages. Now, as a consultant pathologist, I'll be more than happy if you come to me for 95 or 100 tests also every day. But is it really required? So my take-home message for all of you, or my message to you today through this forum would be that first, please consult a regular general physician. There is no point in going on doing hundreds of tests and then a little bit underline somewhere on those tests, and then you are panicking about, what is wrong with me. So my advice to all women is, first of all, take good care of your exercise, diet, nutrition regimen, And above the age of 35, definitely you are going to do certain tests which are required. So first I will deal with nutrition. Let's just take at the nutrition part of it. So we all know that women are prone for iron deficiency anemias, they are prone for vitamin B12 deficiency anemias, and the big thing which is osteoporosis, which starts very early. Though we may feel that it's going to affect us in the elderly women, but it starts as early as adolescence, and also our age group, that is 35 onwards, the active age group. So calcium, vitamin D, even that simple test, that is bone mineral density test. So these would be few of the baseline studies in addition to all the lifestyle disorders which you are going to check. And I think we are going to talk about lifestyle disorders a little later. So right now, let me suffice it to say that please be aware that, say, an iron, calcium, vitamin B12, vitamin D, and these uh, panel of tests may tell you, hemoglobin, of course, may tell you more about your nutritional status than going in for a whole package, which may not really be very easy to even analyze later on. So think about it, go to the proper person, and with their advice, do some checkups for your nutritional status.
Okay, okay. Thank you so much, Dr. Asawari. So I can say that instead of going for the packages, consult a physician and concentrate on the nutritional status, the test which will give you your nutritional status. Okay, thank you. As we are talking about it, as women, we may not land up in the pathologist office, but we look in the mirror every day. So I'll go next to Dr. Swapna. Uh, See, when we look into the mirror, and what are the common skin and hair conditions, problems in this age group, and are they, of course, they are related to our general health, because I definitely, we all know that the skincare is deeper than skin, and it will tell us about the health. So, what are these problems and how they are related to our general health? Dr. Swapna.
Right. Talking about skin after 35, up to 35 years of age, or even after, see, I would first like to say that everybody doesn't have the same pattern. Our skin and our hair are governed first by our genetics. So, our genetic pattern, as in our mom's side, dad's side, genetic history, whatever. Second is the hormonal profile that we've got. Third is our lifestyle, our nutrition, you know, and next would be our skincare routine or our skincare habits. We have to understand that up to 30 years, people do not face much of the skincare problems. I'm not talking about acne and all, regularly with a normal skin. That is because our estrogen, our other hormones are well in balance. But after around 35 years of age, all these gradually start falling. So the first thing that you notice normally is the dryness of skin. You'll start realizing all of a sudden that, previously I didn't have this problem and now I feel my skin very dry. Or maybe initially I used to use a lot of stuff and that never caused a problem. And now I start feeling sensitivity of skin and all those things. We fail to realize that after 30, 35, the collagen remodeling that used to happen at a particular rate previously gradually slows down. The elastin, the collagen, or even the upper layer of the skin, which we call the epidermis, it has to exfoliate every the skin cycle so that the upper layer which has the darkening or the sun tanning effect, it kind of gets exfoliated, fresh skin comes on. This process slows down. So it's a very simple thing that we have to follow is we have to, our daily routine has to change a little bit. We have to concentrate on it. It cannot be that I don't have time, I'm not going to do it. I used to never do it. Why should I do it now? No. With age, if you take good care of your skin, skin does stay well. Now, what is the first thing that you have to understand? That as we say, beauty is not skin deep. I would go one step ahead and say that skin care is not skin deep. Only applying things on your face, getting things done is not going to be enough. It has to start with a little lifestyle change, wherein you motivate yourself and take it up on you that you're going to eat healthy, you're going to sleep well, you're going to exercise, and yes, mind. most of the times we don't consider the stress aspect of it, which kind of works on our hair and skin. So, mind calming exercises, and make this a part of your lifestyle. Don't let it not be like I do it for 3 months and oh, I'm done with it and my skin is fine. No, that is what we want to emphasize, that this should be a part of your life, a part of your lifestyle, so that you have no problem venturing into your other decades further happily.
Thank you, Dr. Swapna. So I can say that it is more of a lifestyle and what you do on day-to-day basis. हम जो रोज करते हैं, जो केयर रोज लेते हैं, that is going to affect our skin and hair, and at the same time, our general health and our mental health, our stress levels are also going to affect it. These are the only visible implications. हम सिर्फ देख रहे हैं कि कुछ changes हो रहे हैं, लेकिन the causes can be much deeper to it. I'll take this question to Ashwini. When we are talking about mental health or stress, this is also the age when we are taking up a lot of responsibilities. We are playing multiple roles, and most of the times when we are doing so, we are also under tremendous pressure, and to an extent as a women, I'll say we are also experiencing some guilt. So how we can work on this for both, for the working women as well as non-working women, how we can take care of this.
Okay. So multitasking generally is a term synonymous with women, and we're very proud of this association as well. Can we survive without multitasking? No. Is multitasking necessarily stressful? Again, no. In fact, the word stress, the term stress is often misunderstood to be a negative force in our lives, but in fact, it can be a positive source. The right amount of stress can fuel our energy levels, can cause increase in productivity, creativity. It kind of brings this energy into our life, excitement, anticipation. In fact, if there's no stress in our life, there's a possibility of feeling bored and dejected, right? So the trick is to kind of identify the optimal level of stress in which you can function. Now this would vary for each one of us, right? So this is the most important thing, is to identify how much stress can I as an individual handle, and how much can I push myself and beyond, and then to protect yourself against over stress. For example, eustress. Now this program that Dr. Varsha has conducted, I'm sure there was some stress involved in, conceiving it, contacting all of us, the technical aspect. There is some level of stress involved, but there's a positive outcome. And this is a good example of eustress, right? So, yes, when does stress become negative? When it becomes dysfunctional, when it starts affecting your life in a negative way, people around you start complaining, you're always irritable, you're angry, you're not sleeping well, etc. So, each one of us, again, there are different triggers for stress. What you mentioned, guilt for working and non-working mothers is often a trigger for stress. When I hear about working and non-working mothers, it reminds me of a nice statement put out by the Supreme Court last year. They came up with a handbook on gender stereotypes, and they mentioned that women should not be defined by any one role of her life. She should be seen as a whole person. But in our society, we tend to categorize and we tend to judge, right? So women who work feel guilty that they're not spending enough time at home with their children. They're not performing all the household chores, etc. Whereas women who are not working may feel guilty that they're not being productive, they're not contributing to the finances of the household. They may experience low self-worth as well. So in both cases, there is some element of guilt. And unfortunately, guilt is one of our greatest obstacles to our sense of well-being. So how do we handle this guilt, right? That's your question. It begins with our thought process. We need to have complete clarity of thought on our choices. Why do I choose to work? Why do I choose not to work? We have to have clarity on this thought process. We have to also accept that both options have their own pros and cons. Whatever journey I am choosing, I have to be comfortable with it, accept it. Whatever the ups and downs of my journey, I accept. I don't compare with anybody else. Also realize that each one of us is wired differently. We all have different value systems, want different things out of life. Just accept that this is who I am and this is what I want and I'm comfortable with it. So this kind, and also I think that as women, we judge each other the most. If we decide to, live and let live, and if all of us, have this collective attitude of living and letting live, then I think the collective guilt of women will also reduce to some extent. The second aspect, the change in our thought process has to be that we have to also believe, rightfully so, that managing a family or managing a household is again a partnership between two people, husband and wife, right? So generally, we believe the complete onus is on us, on the women to manage the children, the household, the family, and hence the guilt. If we change the thought process to believe that it is again a collective responsibility of the family, our guilt will reduce. So there's a lot of change required in a thought process to deal with this guilt. The guilt is because we believe in the shoulds, that as a woman, I should be a perfect homemaker, should be the best mother, should be the best employee. So if we get rid of the shoulds in our life, our guilt will reduce. Now, working, non-working, now Supreme Court may say don't define us by these roles, but the fact is that we do. So, and research does show that women who work do experience greater guilt because we're away from, you're working outside the house. And yes, there's a lot of push and pull. But the good news is that there's enough research to say that, children of working mothers have equally positive outcomes. In fact, sometimes more, they may become more resilient because mom's not always there to, help you in every situation, right? So the guilt primarily for working mothers is that will there be any adverse impact on my child since I'm not always there at home to pander to his or her every need. But the good news is that no, there's no such thing. So that's where women are concerned. So along with the thought process that requires change, there also have to be some practical things that we have to, lifestyle changes again that we need to implement in our life. For example, we have to know how to prioritize objectively. There are always multiple choices in front of us, what to do, what not to do. There may be a time when work needs to take precedence, and that's okay. Do it guilt free. Also, we have to be mindful and be present in whatever we are doing. If you're at work, give it to 100%. You're with your kids, give it 100%. You're enjoying out with your friends, enjoy completely. So that we have to be comfortable in balancing our duty with our pleasures, right? So once that balance, I know it's not easy to maintain that balance, but if we can, then that's just the right way to kind of lead our lives. Learning to say no to, especially in a small town like Belgaum, we have multiple social commitments. Picking and choosing what you would like to do or what you would not like to do also helps in this journey. So I feel that a happy individual, a happy and satisfied individual will lead to a happy and satisfied individual in all other roles as well, be it mother, wife, employee, etc. So somewhere if we just change our thought process and work on leading a more organized and balanced lifestyle, we should be able to deal with the guilt.
Thank you so much. I also felt so good in some parts of it, and definitely my guilt reduced as sitting
Good.
here
Yeah.
in the exam season. So,
Right.
changing the thought process and a little bit prioritizing what you want can really help. Thank you. Going ahead, our healthcare is primarily reactive. We rarely go to a doctor or consult somebody if we are not having any symptoms. हम जब हेल्थ केयर की बात करते हैं हमारी आदत ये है तकलीफ नहीं है ऑल इज गुड इफ कोई तकलीफ नहीं है बट इन सम एस्पेक्ट ऑफ हेल्थ केयर समटाइम्स इट मे नॉट बी ट्रू. I'll come to Dr. Asawari again. So, can you tell us about the most common women health issues which can be prevented if they are detected early or they can be easily treated?
Yeah, thank you, Dr. Varsha. So, just like you said before, when you asked me the first question, we were dealing basically with women above the age of 35. And we covered in that section a little bit about nutrition, diet, and how that affects our health, and what are the parameters which we should be checking right from a basic hemoglobin to your nutritional status. Like you said, ignorance is definitely not bliss as far as women's any kind of preventive health is concerned, and especially women, because one step further to the guilt question is that we feel that we are super women and we will, go on working even when we are ill or we are not feeling up to it. We will still have to make that go that extra mile. So these are things which are inbuilt in us. Can't really do much about that. And very important point was brought out by Dr. Swapna as well regarding the hormonal changes. So now from 35, if I move to the next decade, say around somewhere around 45, now this is a premenopausal woman, and at this point again, she's going to be hit with a lot of diseases which can have better outcomes if they are detected early. So in this age group, I would like to focus on two basic things. One is your breast self-examination along with a sonomammography maybe, and for your cervical health, a pap smear along with a status of human papilloma virus, that is the HPV test. So for your breast self-examination, kindly mark out a calendar or a date on your calendar, ideally the fifth day after your menstrual cycle, and with the palm, not with the fingers. Please examine both breasts while you are bathing or while you are in a private space. Look for any changes in consistency, any lumps that you feel, or a nipple discharge maybe. And if you do find that, definitely consult somebody. But even if you don't, and now is the right time to start going in for regular mammography. So the first should ideally occur before the age of, say, around the age of 40 to 45, and then every 5 yearly, it is advised that you should go for a mammogram. If you have incidence of breast cancer in your family, then definitely go for the next step test, that is BRCA, what we call it BRCA1 and BRCA2 test, which is available now with us and tells us the predictive index, that is there any chance that you might develop a breast cancer. Now, when I say the C word, please don't panic, because here we are talking basically about prevention. And at the beginning, I said that if you pick it up early, the outcome is going to be very good. All right. So ignorance is not bliss. Don't wait for the end while you do feel a lump. Go in for the preventive care. The second is Pap smear along with HPV testing, which is now the considered to be gold standard. So all the gynecologist associations would now advise you that after the age of 30, please do a pap smear along with an HPV test, so that you increase the timing between two pap smears to 5 years. If you do only a pap smear, you will have to repeat it every 3 years. And HPV test is giving us very important information that are we prone for cervical cancer. Now, these are the two which come to mind. There are many others, and I did mention osteoporosis, which is again going to set in a little later now, but can be prevented right from this age. So these are my three takeaways for this particular section, which is about the changes in hormonal levels and the imminent premenopause, menopause, while your calcium levels are going haywire, your hormonal levels are going haywire, and as well as your breast and gynecological or reproductive health goes.
So the breast examination every month,
Yeah.
your mammography every 3 years, and pap smear every 3 to 5 years after the age
Yes.
of 35 to 40.
Yes.
Thank you, Dr. Asawari. As we have been discussing lifestyle changes, and we have been discussing it, let's go to Dr. Swapna. She had mentioned it. Are there, when we are talking about the hair and the skin issues, you did mention that lifestyle plays a very important role. So, what are these lifestyle changes which we can do, which will help us not only with the skin and hair issues, but also overall health?
Okay. Ideally speaking, I would be talking about these ideal lifestyle changes that we require. It might not be possible for everybody to follow everything that I say, but I would rather want to tell you, why don't you take it up, all of you who are saying, as a 28-day challenge. So take it up as a challenge, have a book or a journal where you write down, on the day what you have followed, what you have not followed, Because every time you look at your journal, you'll realize ki what you have done or not. The first thing is about sleep. And sleep, I would say 7 hours. We all know 7 hours of good sleep. But what time? I would say from 10 o'clock or 11 o'clock onwards, 7 hours. This is because of the simple fact that 10 to 2 o'clock in the night is the secretion time of our melatonin hormone, which is very much required for your hair, your skin, and your overall functioning of the body. So make it a point to sleep by 11 o'clock, a good 7 hours sleep. Get up early if you want for other works, but start with that. Second would be your physical exercise. Physical exercise for the simple fact that whenever you exercise, whenever there is cardio, when you do a cardio and your heart rate goes up, there's a lot of blood circulation happening all over your body, including your face. So this blood circulation dilates your blood vessels, bringing in a lot of nutrition to your skin, your hair, and taking up back toxins. So that gives you the internal glow which is required. Third thing would be mind calming exercise. I insist that every day take out some time for yourself. We are all talking about self care, we are talking about skincare routine, apply this, apply that, self care. But in my opinion, the best self care that you can give is 15 minutes of a mind calming exercise. It might be meditation, it might be simple breathing, it might be even mindfulness. Close your eyes, breathe. Do not think about. There'll be thoughts, but yes, try getting your concentration on breathing. The fourth thing would be nutrition. Invariably, we are so busy taking care of the nutritional needs of our family, or maybe other things, that in the whole process we forget to concentrate on ourselves. So you have to plan your meals. It cannot be like today I'm going to eat this and this. It doesn't happen that way. You have to plan your meal wherein you include a lot of green leafy vegetables, then salads which are colored because they give you keratin as well as natural vitamin A's. So carrots, corns, beetroots, broccoli, whichever is like you can use. Sprouts, which for the protein part. Seeds. So these include pumpkin, sunflower, chia seed, flaxseed. They have a lot of vitamin B12, or you can say omega fatty acids. If you eat non-veg, then fish oils are really good, eggs, and also concentrate on those minute nutrients which are there in nuts, uh, fruits, a fruit every day, and see what happens is in our regular food, protein requirement that is required after a particular age, because our body muscle starts deteriorating, muscle mass. So first thing is protein requirement. So see to it that you're eating enough protein, which would be somewhere around 1 to 1.5 gram per kg body weight. So if you're a 50 kg person, maybe 50 to 60 grams of protein every day you require, which is not what we get every day in our meals. So concentrate on that. So this is how you make a meal plan and have it every day. Next, coming on after all this, coming on to your skincare, I would say first, to reduce your stress is do not compare your skin to anybody else, because your genetics, your hormonal profile, and your lifestyle is going to be totally different from the other person. Instead, when you start with all your skincare journey, compare your skin to the same skin you had to your own skin 1 month back. And that is where you begin from. So, first, reduce the stress of comparison, and you will be able to find the difference in your own skin when you take up this challenge. In case of skincare routine, I would suggest the first anti-aging that you have to start with is a moisturizer. Now, a moisturizer, one thing fits all skin. No, that doesn't happen. You have to understand your skin a little. Either you do it yourself, if you can do it, or at least consult a dermatologist, get a basic idea what your skin type is. And accordingly, if you are acne prone, you'll be using a gel based moisturizer. Or if you have very dry skin, then it would be a ceramide containing moisturizer. So, yes, first step would be moisturization. And along with it, very, very important is sunscreen. For the simple fact that UV rays, it actually depletes our collagen, and it kind of exfoliation of the skin reduces. That is the tan effect which is there. The tanning effect increases. So a sunscreen, depending upon the season, twice or thrice is required. Only after all this comes retinol and then hyaluronic acid and all these things. So these are the basic changes that you have to start with.
Okay. Thank you, Dr. Swapna, for that insightful thing. Unless we make our lifestyle healthy, healthy inside is healthy outside. You won't see the results unless you are making the changes from inside. And along with that, there is always a moisturizer and sunscreen, which can help you to take care of your skin and uh, go in the aging process mindfully, I'll say. I'll take the next one to Dr. Ashwini as we are talking about the prevention. When it comes to mental health, it is, I think Ashwini is there. We'll take the next one with Dr. Asawari, and then I'll come back to Ashwini maybe. As we are talking about the prevention and everything, there are certain problems which may require intervention, which may require treatment. हम कितनी भी कोशिश करें, some of the problems are there जो बिना treatment के we cannot solve. So let's get to know about some of the common problems which may require treatment or which may require intervention from Dr. Asawari.
Yeah, thank you, Varsha. And I just forgot to mention one thing about the sonomammography and pap smear per se. Many women don't do it because they feel that it is very painful. So let me just put your minds to rest that it is not, it is slightly uncomfortable. I will not deny that, but it is not a painful procedure. It is pretty much just, you will feel little bit of discomfort, but it's not really very, and it won't carry on for too much time. So don't avoid doing these tests just because, you are scared of the pain associated with them. Moving on to this other question, which I had said even in the beginning, that we'll deal with lifestyle disorders per se, or the tests and prevention as well as treatment for lifestyle disorders in the last segment addressed to me. So we have all heard about hypertension being a silent disease which doesn't really give much symptoms. Same with blood sugar. In fact, it may not always show you increased urination or weight loss or any of those, or increased hunger. So we may attribute it to something else and lose out on diagnosing it. So in fact, it is now said that blood pressure, and along with blood pressure, blood sugar should be the fourth vital sign which you test in all population. So whenever you test anybody's pulse, blood pressure, temperature, you should also do a blood sugar, because we are in the diabetic capital of the world. So along with diabetes, along with hypertension, one more thing to remember is in this age group, now we are moving one more decade ahead. Suppose in this age group, post-menopausal age group, the incidence of heart disease is equal now for men and women. Before this, women have estrogen, which is cardioprotective, and therefore, they're not very much prone for heart disease per se. But now is the time where it may come up again and rear its, ugly head, so to say. So we have to be very aware about our liver function, our kidney function, our cardiac profile. Like, for instance, you will check your lipid profile as well very regularly after this particular age. So these things which will tell you about your cardiac health, your liver health, and your kidney health, along with not just blood test, but also an ECG, maybe the glycosylated hemoglobin test, which is very important at to find out, are you pre-diabetic, are you diabetic, whatever. So these simple tests are going to tell us about lifestyle disorders, and these diseases are increasing in incidence because of our lifestyle. They are increasing because of our stress levels, our surrounding, the way we live in our environment, and even strokes are going up very much, the incidence of strokes. And these are conditions like heart disease, hypertension, diabetes, stroke, or even fatty liver in women. Very, very commonly, you will see fatty liver in women, because we are in the sort of epidemic of obesity right now. We are all overweight, most of us, with sedentary lifestyles. So fatty liver is a neglected part of women's health, actually, should be addressed. And these are all diseases which need intervention. So they are not going to go away by just, mild modification. So yes, lifestyle modification will be the first step, but they will need treatment as well. And we should not shy away from this. We should consult proper experts, get ourselves tested regularly, understand our basic cardiac, liver, kidney health, and be, prepared to address certain issues if at all they do crop up at this stage. So, though we are hoping or wishing a very, very healthy life to all of you, but please be aware that sometimes things can go wrong and those need intervention at the right time. And we should be very, very proactive in getting that intervention. Let's not waste time in, too much of procrastination कि मैं सोचूंगी करना है कि नहीं, इतना ही तो बढ़ गया है, थोड़ा ही ज्यादा है, ये सब नहीं चलेगा. इमीडिएटली वो चीजों को एड्रेस करना चाहिए ताकि आप ज्यादा आगे जाके कॉम्प्लिकेटेड डिजीजेस में नहीं आप वो कैटेगरी में नहीं पहुंचेंगी.
Exactly. Taking action at right time can help us in improving the quality of the life which we are going to have till 80, 90, 100. Why not?
Yeah.
So
Yes.
I'll come back to Ashwini. We lost one question in the preventive care. So we have been talking about this prevention, and we have been talking about mental health and taking care of mental health also. But the changes are going to happen in our life. Is there any way, for example, our kids, we center our lives around our kids, we are so engrossed in them, our life revolves around them, and sometimes they grow up, sometimes they are in the house and we feel that they are not connected to us, and sometimes they go out for study and work. So is there any mechanism where we can prepare ourselves for these changes?
Absolutely, yes. We all know that certain challenges await us, like perimenopause, menopause, emptiness syndrome, age-related health issues, the feeling of being irrelevant as we age. All these are part of life, and we know that we're all going to encounter this at some point or the other. There's no point being in denial. These days, we all believe that, 60 is the new 40 and 80 is 60. All of this is great. It feels good. But the fact is that we are physically aging, and, a lot of natural changes do take place, and we will go through these challenges. So just like how, suppose someone wants to go on a challenging trek or is going to run a marathon, how we prepare ourselves, right? First, what do? We assess ourselves. What's my stamina? What's my current heart rate, speed? What are the, and then you set yourself goals. That suppose in 6 months I have to go for a marathon, I need to be able to, achieve these fitness goals. So similarly in life, when our mental health is concerned, when we know that we are going to face these challenges, we have to prepare ourselves first by assessing our current mental health, right? Where am I right now in my life? So the first thing we could assess is our ability to handle stress. On a scale of 1 to 10, 10 being I'm fabulous, which doesn't exist for any one of us, and 1 being I'm extremely low at it, right? So sometimes, the question comes, how do I assess myself, right? How easily do you get stressed? How much anxiety do you have? So, and people, if you can't assess yourself, your friends and family, I'm sure will, able to give you a fair assessment on how you can, how good you are at handling stress. The second very important parameter is your self-esteem. How good do you feel about yourself? Do you like yourself? Do you respect yourself? Are you happy with where you are in your life? So self-esteem covers a lot of important components and has a very strong correlation with our mental well-being. So if you have high self-esteem and you have good stress management, you're able to, your coping mechanisms in life are good, then you will be able to handle the challenges that come your way. Now, if in your assessment you come to know, okay, nahi, my self-esteem is not very high, for example. So what I would say is that an ideal number for your self-esteem would be 8 on a scale of 1 to 10. 9 or 10 would be narcissistic, where you think you're God's gift to mankind or you love yourself excessively. So 8 is a healthy number. But if you assess yourself to be a little lower, let's say you're at a 5 or a 6 or a 7, you have to assess what are the factors which are holding me back from being at an 8. There are various factors why we don't feel good about ourselves. We may feel that I'm not very motivated, I have no purpose in life, I'm not being productive enough, my relationships are not great. So there are, my communication is not good, I may not speak English fluently, or I'm not very confident, I'm not happy with my career. So many variables which are preventing us from being at an optimal level of well-being. So once you identify what are the factors which are preventing you from being, at this optimal level of well-being, you make a list and try to see, is there anything I can do to change these now, right? Because again, as we get older, change is harder. So you were saying post 35, so 35 to 50, at least 15 years, you have to make all the changes that you would like to. As you get much older, it's harder. So make an assessment, diagnose yourself, figure it out. I know it sounds easy, but it can be done and should be done. So coping mechanisms also. So like it's very simple. The fitter you are, both mentally and physically, you feel that I can deal with anything in life, right? So your stress management abilities also depend. We said that the more number of skills you have across different dimensions of your life, the better you can handle your stress. So take this time to assess where you are and work on self improvement. Make different areas, like how Dr. Swapna also mentioned, keeping a diary of what you do and what you don't do. You can have a to-do list. Suppose the communication is an issue, I can join spoken English classes probably to improve on that. If I'm not feeling motivated, I have to figure out what I want to do with my life. So these have to become primary objectives. Very often we're leading life in cruise control, one day after the other. Bas din chal raha hai, aaj ek din gaya, basic kar rahe hain, khush hai. There's nothing wrong. But sometimes, at midlife crisis, right, you just wake up and you feel, what am I doing with my life? And that's when actually many people do make changes in their life. We see people who are very successful corporate honchos give it up and join an NGO because that's what they want to do with their life, right? But all this happens only if you introspect, if you are self-aware and you're proactive, right? So this is to be a very conscious effort to kind of make these changes in your life and prepare yourself for the challenges that face all of us. And those of us who are successful will be the ones who have been proactive and worked on constant self improvement. So it's very much possible, but you have to be very active in this entire process of self awareness and self improvement. Yeah. Not easy, but definitely can be done.
So we have to be aware about what we really want, and we have to work on those skills also. Not only it is not only it is going to help when we say that nahi, I want this, but if we are not able to work for that, it is not going to work. And maybe having
Absolutely.
hobbies and converting those hobbies into skills and making something of it can help.
Right.
Thank you so much, Ashwini. I'll take. We were on the treatment part as we were talking about it. Swapna, are there any treatment options? We were talking about the preventive care and the lifestyle, but for the hair and skin problems, are there any treatment options when it comes to women above 35? Because we do have certain problems which we like to take care of.
Yeah. So the like all of us we know that the major issue that happens is hair fall, thinning of hair. And then comes the psychological stress with it. I had such good hair, such lush, nice this thing, and now it's all dry. They are dry, and I can't manage them, and I'm losing a lot of hair and all. Wait, this is bound to be there. You have to work on it. How do you work on it? One, patience. I would say patience and compliance. Because we feel that skin and hair can be treated in 15 days. No, that doesn't happen like that. For the simple fact that the hair cycle or the skin cycle has a particular time in which all the process takes place. So if I say a 28-day cycle is the skin cycle, a hair I would say would be a 3-month cycle where the hair grows, comes, it stays for a longer time, more years, and then hair fall, and also it takes time. So compliance is very, very important. In this, initially you have to start with supplements, and I'm not saying the basic supplements, but supplements which are specific to your hair, nutrients specific to your hair, like calcium pantothenate or biotin, or maybe selenium or manganese, which are not found in that much amount in our regular food, or the quantity that we eat is not enough. So yes, you can start with supplements. Here you should understand one thing, कि after 35, 40, the absorption capacity of your gastric, as in your stomach and intestine, also reduces a little. And that's where you have to have power packed nutrition or maybe supplements. Okay. So along with the supplements for hair, sometimes whenever there is a growth factor that is that are reduced, we might have to do a growth factor concentrate or a PRP therapy depending upon how the hair this thing is. Along with it, that is done with your own blood where your growth factors are separated or your platelet rich plasma is separated, and then put it into the scalp or the hair roots. Okay. Now coming to the skin part, um, basic, I would say, a chemical exfoliation or a medical exfoliation, wherein a little stronger AHA, BHA acids are used, and depending upon your skin type. So every person is going to have a different combination for this, depending upon your skin. So that is something that. So I usually promote the skincare pyramid, wherein every day is your skincare routine. Weekly is where you will exfoliate with your serums and all those things. Monthly, maybe you will take a facial or something which you regularly do, and or a chemical peel or a carbon laser wherein you kind of medically exfoliate the upper layer, which as I said takes time after a particular age. And yearly maybe you can go in for something like, for aging skin, previously we had injectables, we still have injectables, but now the latest technology like high intensity focused ultrasound or Althera, which are HIFU, is relatively painless. So that can be done once a year for the aging skin. Now, there are a lot of patients who ask me, once I do it, and is it permanent? So I would rather say कि if you're not aging and you stop aging, it is permanent. But our age progresses, our other things are going to change. We are exposed to the elements. So maintenance is a must every year or maybe every 6 months. So in that case, two things. You can start with your supplements or whatever prescribed by your doctor, and be patient, be compliant, and you definitely will see results. In case you're not, then as Dr. Asawari told you, we have to do certain parameters like your thyroid profile or maybe your hormonal things like LH, FSH, or a scan to rule out PCOD. Now, another thing that troubles women in this age group is adult acne. So usually acne is in the adolescent age group, but because of certain hormonal changes, some people experience this acne during this age after 35, 40 and all. First thing I'll say, please do not pinch, do not squeeze, do not scrub, and do not use home remedies, because that, although home remedies might be safe for your normal skin, but whenever you have an inflamed skin, it can lead to a sensitivity or a reaction which might cause pigmentation. So that is where, when it starts, take care and consult a dermatologist.
So consistency, mindful following, and how skincare is continuous, even the aging process is continuous. So maintenance is key, and at the same time, consult an expert. Thank you so much, Dr. Swapna. I'll come back to Dr. Ashwini. As we are talking about all these things for the physical health, we have a lot of parameters. We can have tests, we can physically examine the patient, but sometimes it becomes difficult to judge in case of a mental health. So when is that time, with so many issues cropping up with our high stress lifestyle, when is that time when I would know that this is beyond my regular coping mechanism, and I need to see the counselor?
Right. Yeah, as you said, all of us go through difficult situations in life. We feel low, we feel anxious. So generally, what do? We introspect, we analyze our feelings, और फिर हम अपने आप को समझा लेते हैं कि कोई बात नहीं, ये जिंदगी है, होता है. I'll feel better. We talk to a few friends. We think of all the positivity in our life, and we try to help ourselves. And generally, that works, and we come out of a tough phase or feeling low or feeling anxious. But if these feelings persist, this feeling of hopelessness and feeling low, when you feel, I don't feel like getting out of bed and facing the world, the things that normally interest you are now not interesting you anymore. And if these kind of negative feelings persist for more than about 2 weeks, it's time to see a professional for help. And it is difficult. It also depends upon one's tolerance, right? Some people are okay being miserable, And so very often people are depressed or are going through anxiety, going through panic attacks, and they spend years that way, unless someone physically forces them to come and seek therapy. I have people who've been suffering for so many years, but they take their own sweet time, and it's so sad, but they say aadat pad jati hai. So that's a very so it depends upon an individual's tolerance also. There are some people at the slightest hint of feeling low, they go through a breakup, they're feeling low, and they'll come for therapy. The younger generation is more proactive in seeking therapy, which is good, because if we kind of like any medical problem, intervention happens at the initial stage, the healing process is also much faster. The longer we wait, especially emotional damage, it kind of seeps into your unconscious, subconscious mind. If it reaches that level, it's extremely hard to then help such people. So it does make sense to come in the initial stages itself. You will need fewer sessions to heal. Now, if you come after a much longer period, it's going to take you maybe 6 months to a year of therapy to start feeling better. So, the guideline as such is about 2 weeks. If you're not feeling, if you can't handle your own emotions in about 2 weeks, is when you should seek help. But then again, like you said, since this is it's a very subjective field of emotions, and how much people can handle, or how much people deserve they need to feel. The sad part is many people are okay about not feeling good, right? So the family system or the friends, the social support should be proactive. I mean, even I've seen 50% of my clients don't come on their own, they're brought by a family member, right? I think this person needs help. So there's also a stigma associated with seeking help, unfortunately. So that is what also prevents people from seeking help. So this is one category, is you seek help when there are clinical symptoms. There's another category where you are maybe going through dissatisfaction with life, right? This is at another level. So therapy or counseling is not only for helping people with clinical symptoms, it's also meant to help people lead a more optimal life, lead a better quality of life, lead a fully functioning life as an individual. So in this case, there may be people who are functioning all right, but they feel something is missing in their life. They're not feeling motivated. There's no lack of purpose. They feel, or they've seen some patterns in their life which are disturbing them. That, in my relationships, I tend to withdraw very quickly. Or, they realize that attachment styles are insecure. So these kind of issues which are long standing also need therapy. And it's a different category of, again, self-awareness, where you realize that I need help. There may be no clinical symptoms, but the quality of your life may not be optimal. So that is also another area where we seek therapy. And the third area is when we sometimes just need another opinion on some decision in life. It's like how some people go to an astrologer to say, should I marry this person or should I change my job? So similarly, these days people are coming to therapists to say, what do you think? So premarital counseling also comes into that. So I would broadly say these are the three areas or times when people can or should seek therapy. It prevents things from getting worse. If you keep sitting with an issue, we don't know when it's going to explode and then require a major psychiatric intervention. So like the general theme has been, prevention is better than cure.
Thank you so much. That actually makes sense, that because as we all know, our mental health has a major impact on our physical health, and sometimes it can lead to very grave consequences. So there, I'll make this point again. There is no harm in asking for help, even for your mental issues. There is no stigma. It is as simple as going to the laboratory and getting yourself tested, or going to the physician and taking medicines for your diabetes or hypertension. If we come to that, and I would say that our kids are much more open minded in this, and we should
Absolutely.
learn from them. So thank you so much, doctors, for this wonderful insights into the physical, mental health of women above 35. If you could quickly give me a take-home message for all these beautiful, wonderful women out there. We'll start with Dr. Asawari.
Yeah, so thank you. As we come to the end of this, very quick carry home message. First is I'd like to start with the cliche, health is wealth. So please prioritize your health. And there are fitness does not mean health. being having no symptoms does not mean health. So you need to go for regular checkups. And once you assess your nutritional, hormonal, and your lifestyle disorder profiles, and you find everything is fine, that will say that yes, you are healthy. If some issues do come up during the regular checkups, then don't go wasting time in confirmation. You can take a second opinion, but don't go window shopping. ऐसे मुझे हो ही नहीं सकता, वो डॉक्टर बोल रहा है, ये डॉक्टर बोल रहा है. If some issues do come up, then please remember, a bend in the road is not the end of the road. So take action instead of wasting time on confirmation. And most of the issues which will come up can be tackled effectively in medical science as of now. And my third take home message is that it takes a lot of effort and resources to stay healthy, but it is much less when you compare to the resources that you will need if you fall ill. So please do your preventive health checkups very regularly and take care of your health, because you are worth it.
Dr. Swapna, that is so wonderful.
Yeah, I would like to say कि don't base your this thing on skin and hair. Love yourself. And when you love yourself, in the process, skincare should be a part of it. Your hair care should be a part of it. You are not doing it for anybody else, but you do it for yourself. You feel good about it. Start with the changes that you can do. Otherwise, we all are there to help you for the further enhancement. And prevention is better than care. A generation before, we didn't have things, or we didn't have the knowledge where we could prevent aging. Now definitely we can postpone aging when it comes to your skin, and postpone the injectables and all, maybe from 45 to 55, if you take good care of your skin. So be skin healthy, be mind healthy.
Wonderful. Dr. Ashwini.
Yeah, those are great messages. I like that: mind healthy, self love, and as Asawari said, we're all worth it. So I think yes. So the message probably, just to summarize, is to we should invest in ourselves. In our health, physical, mental, spiritual, and all. So basically, we don't generally, the guilt topic also, that we tend to invest in others, in our family, and everyone else's well-being but ours. So I think it's time to also invest in our own well-being, and also that, like, how we assess our temperature and physical parameters, blood pressure, sugar levels, etc. We need to be able to assess our emotional health as well. Am I, like, how often do I feel sad? How, like I said earlier, that we are okay with not being okay, and that has to change. We have to be okay. We deserve to be okay. We deserve to be happy, and we need to work towards it. Doesn't happen organically. We do need to put in some effort towards our mental well-being and our happiness. So yes, wishing all women out there, happy Women's Day, and just happy well-being in all areas of your life.
So, to summarize, take action, prioritize your health. Self care is not selfish, and we deserve the best. So, happy Women's Day to all. We will be back again with the second session, which we will concentrate more on the lifestyle, injury prevention, and stay healthy. And bye bye from our end. Thank you so much.
Thank you so much.
Thank you.